So, good afternoon. My name is Diana Moar. Our family is Soto. We're Anishinaabe. We belong to the Barons River First Nations in Manitoba. I'm the Aboriginal Patient Navigator for the North Okanagan with Interior Health. I've been in this position for over 7 years now, and the position entails supporting and assisting Aboriginal patients and families both in hospital and community in accessing healthcare services and supports that are culturally safe, culturally appropriate, culturally sensitive. Also, cultural safety also includes our healthcare staff, also both in hospital and in community, to ensure that they also are respected as our community members. The work that we do could be challenging, has been challenging, especially with our Aboriginal community members in accessing culturally safe and appropriate healthcare services and supports. There was always challenges and barriers to even have their voices heard, to be able to speak to their health concerns, their health issues, and bringing them forward. So we, as Aboriginal Patient Navigators, we ensure that we link, we bridge all healthcare services and supports, and by that I mean we connect our community members to if they're needing assistance by the social worker, or if they're needing translation with a doctor, with a nurse, because quite often our community members, English is their second language, and so therefore they will require somebody that can translate the terminology, the medical terminology. So we do assistance support in that area, or we bring in a community member that speaks Okanagan or Shwetmik or Soto to provide that translation, that interpretation. Also, the linkages is important, whether it be social worker in hospital, community, nurses, doctors, dietitian, even with as far as even managers of the hospital, of the different units, just to ensure that we wrap those services and supports around our community members, that they're heard, that they do get the health care that they are needing in order, for their wellness and their well-being. So basically, we are a bridge to healthcare services and supports. Initially, the round tables meetings were initially started through an incident. It's just unfortunate that change needs to happen or does happen when there is an incident. So with this particular incident came our round tables, and from the round tables came the walkthroughs, which we had in Emerge, and then even from the Emerge with the walkthroughs came a request for our elders by staff to have a cleansing and a smudging ceremony. So from our roundtable meetings to our walkthroughs actually opened more doors, more opportunities, not only for our Aboriginal patients and families, but for our health staff, where we are working together in a very respectful way and an honoring way. We continue to do this only to ensure that cultural safety is provided for everyone involved, that we don't lose that connectedness with our community members, our patients, our families, and with our staff. And it's quite important that this continues because, as you know, that there's always a turnaround in staffing. So, the education needs to continue. So the education is provided through our roundtables. And, if we should have another walkthrough, then, we will have new staff members involved in that process. But this process opened more doors, increased relationship, and relationship and increasing in trust of our communities to access further healthcare services and supports, not only in the community, but especially with our hospital. And we further continue to work on to that end, to ensure that this is not lost again, because we've worked too hard to, along with our community members and our community partners, to get where we are right now, and just to continue to ensure that our community members continue to have the culturally safe, access to culturally safe services, healthcare services and supports. Thank you, Miigwech.
Is there anything else you wanted her to specifically answer in regards to the cultural walkthrough, like her involvement? Did you take part in the cultural walkthrough, like personally? Were you there during it?
Yeah, just at the beginning.
Okay.
Yeah.
Do you want her to talk of what her thoughts were around it, how it went? I don't know. I'm just throwing ideas out here.
Yeah, no, it's good. No, that's good. Is there anything else you'd like to say about the actual walkthroughs, or what came out is wonderful. I think that's enough because to be honest, I can speak to the mechanisms of the walkthrough, what we did, right? The richer part of this is not that. The richer part is having you speak about what that experience meant for you, centered in as you are in Vernon Jubilee Hospital, because what we did on the walkthroughs specifically, I can speak to.
Yeah.
You know what I mean? Like,
yeah.
The question I was going to talk about, I was going to ask you, and I don't know if it's an opportunity while here is to do you want any like photographs of say the department?
I did.
Just to sort of talk about because we could probably, if you've got time, Patrick, do that.
Yeah.
Because basically, as long as there's no patients,
looking at
I know.
but we can maybe take a picture of
I know, I
like
saw
the
that.
security
No, it's
doors
okay.
while they're closed.
I know.
Just from an angle from
You
the
were-
side
you
of
were,
the trauma room.
Yeah,
because I know that was a.
I
that
know.
was a-
directed at her,
what
that's all
I will
that
speak
matters.
to that about the preparation.
It's just as soon as you
for
look
that.
into the camera,
Yeah, I will speak to
the
that.
people that are
and I'll
watching, it's
speak
like
to the
they
debris,
think you're looking at them.
So like the main entrance,
Yeah, no,
like
that'd be
where you come into